large since the last time.
Oh.
But it is large enough to really talk about surgery, especially if you're in better shape.
Oh. Surgery, I don't even think about.
They are, so I don't think open surgery is the way to go.
I agree there. I agree.
Right.
The way I feel, yeah.
If it's any, should be minimally invasive.
So Dad, what he's saying is not to cut you open like this and do surgery. He's talking about non-invasive surgery, like arthroscopic, where they put a tube in your in your leg, like they've done it before, right?
Very, very similar principle. It is still surgery, but there is small incisions. They are about a third of an inch, and it's over the groin.
So they put a cut down here in your artery, in your leg artery, and they go into that with the device, and they fix the aneurysm.
What's the procedure called?
It's called stent graft repair of aneurysm. And again, I cannot twist your arm to make a decision, not at all. I'm just saying that last time we did not discuss further because you were sick. You were in a hospital,
Yes.
and now there was some bleeding from the
Right.
the bladder. We have to stop some medication and so forth. The possibility of repairing an aneurysm with minimally invasive techniques still there.
Yeah.
So it really depends how you are overall. If you on a bike 45 minutes and you're doing okay, I think you're in much better shape than when we last saw each other.
Yeah, I would say so.
So you're saying he'd be able to handle the surgery?
I think if we, again, this is going on for a while.
Right.
If we gotta deepen the discussion, and I know you're not from San Francisco, we should see each other.
Do you want to? Do you want to set up a time?
It's up to you. It's very hard for me to really assess how you are over the video. I don't book surgeries like this over video.
Sure.
I have to really see it.
So he wants to come. He wants you to go for a visit.
And again, there's no rush on this.
Yeah.
The aneurysm, it is large enough, but it's not bigger than before.
Oh, I see. It's not bigger at all?
It is a calculated risk. How you doing, how invasive the procedure is, and what's your benefits, right? It's all calculated risk. So think about it. You have a lot of help surrounding you there. There's no rush. But I think the picture is better because you look to me healthier.
You do.
Yeah, he's doing better. He's grumpy, but he's doing better.
Yeah.
Hey, Dr. Yano.
Yes, sir.
If this was your dad, what would you do?
I have to eyeball him.
Yeah.
Yeah.
Oh, yeah.
If you're considering this,
Yeah.
there's no way that we're gonna have a more meaningful conversation. I have to look at him.
No problem. How long do you think he'll be in the hospital? A day or two, or is it outpatient?
Probably overnight.
Overnight.
Yeah.
And afterwards, would you be putting him on any blood thinners or no?
Say again?
You wouldn't be putting him on any blood thinners afterwards? Or yes? Anticoagulation? No.
Okay.
And so the doc, the plan is you cut out the aneurysm and you put in a stent, or what is the quick
We go from the groin, a device travels through the groin vessels back to the aorta where the aneurysm is, and a device is deployed right there.
A stent, right?
Yes.
Got it. Okay.
So the actual aneurysm, the bulb in the aorta, what happens to that?
It remains, but there's a
There's a-
device inside,
inside.
Providing support.
and the aneurysm itself is no longer pulsating. Make sense?
Oh, okay.
Okay. That makes sense.
No rush.
How would this improve his life? Getting the surgery.
No. No.
What?
You just prevent the aorta
And bursting.
to cause trouble.
Got it. Okay.
Enlarges, it can rupture. If you rupture, there's a massive hemorrhage, as you can imagine, right?
Yeah.
Right.
That's the, I won't say only thing, but this is the main purpose of the discussion.
It just saves your life.
Wow.
It's just gonna
Yeah,
save your
it's
life.
only going to save your life. That's all it's going to do.
You're not gonna suddenly like.
Yeah.
You won't
You know?
get younger, won't get smarter. What can I say? I'm just saying what it is.
You won't get smarter.
Won't get smarter. No, jeez. Well, you want to set up an appointment to visit?
Yeah. Do you want to set it up? What's your office to call us for an office visit?
If that's possible, I know it's a travel. There's some logistics to be worked out there, but again, there's no rush. But if you guys, again, I'm gonna answer with a question. If you guys are considering that, I have to see him.
Yeah. Of course. Yeah.
There's no way they're gonna say yes, they're gonna fix you, and I'll fix you over a video. Although I understand technology and so forth, but there's something to be said about seeing and examining the patient.
Understood.
Okay.
Would you be
And
okay
again,
going in?
There's no rush. He's been stable. He's been there. He's not enormously larger when we last saw each other.
Mm-hmm.
But then again, he's large enough. And again, you can come here. We have a discussion, and you just might say, "Listen, I'm old and I'm not gonna have this," which is fine with me. But at least you close the loop. You don't leave anything open,
Right.
Right.
right?
So he wants to talk to you about what's going on with the aneurysm and the possibility of having
Okay.
surgery.
Again,
He wants to be able to see you. He has to see you in person.
Yeah.
Okay.
Dinner and talk about this. There's no rush in deciding anything.
We're just
in the middle of a
phone call.
I agree there. There's no rush for it.
Yeah. Well. Yeah. You have plenty of time, right?
Okay.
No.
All right, Doc. So your office will call us to set up a time.
Yes. Yes.
Okay.
I'll set up my nurse to call you guys. Okay?
That sounds great. Dad, any questions, Dad?
Thank
Okay.
you so much.
Ciao. Thank you.
Bye-bye now.
Bye, Dr. Yano.
Bye bye.